The day after Father's Day, I was shaving and I felt a lump in my neck. I was concerned. I was very concerned. I'm a healthy guy. I've never smoked. I stay active. I'm an outdoor person. I love mountain biking, snowboarding, hiking, just being outdoors and staying active. So got the CT scan results. There was definitely a swollen lymph node with some necrotic tissue. So my doctor referred me to ENT, saw him, and he looked at my CT scan. He did a throat scope. He's like, well, I have good news and bad news. The bad news is I'm 99% sure this is cancer. The good news is it's a pretty treatable, even curable form of cancer. And he began to describe this virus-associated cancer. It's actually HPV. He said, you could treat with me. He said, but I'm going to recommend that you treat with a Dr. Silverman at the University of Cincinnati.
Patients like Mark who have these human papillomavirus or HPV-driven types of cancers are actually in the rise among men in his age group within the United States. And what we're finding, which was really unique among these type of cancers, is that these patients do very, very well and have very high cure rates. The Vinci robot is a specialized robot that not many centers in Ohio have. So we're lucky that here at the University of Cincinnati Cancer Center, they were able to use this robot because it's technology that allows us to treat these patients in a minimally invasive way. So just one more way that we can offer the state-of-the-art surgical care for these patients.
I had surgery on Monday, September 11th. You have to stay in about 3 days because of the risk of bleeding. Everything looked good. He's like, okay, you can get back to your normal stuff.
It's fantastic to be able to deliver great news to Mark, to tell him that he's cancer-free. And honestly, that's what makes this entire job worth it. Cancer care is difficult for not only patients, but also their families.
Based on my journey and my experience, that this type of cancer, the number of cases that they're seeing is skyrocketing, especially for men. To other men out there in their 40s, 50s, 60s, whatever, if you're a candidate for surgery, I highly recommend it. I had a really good outcome. I think the team here at the UC Cancer Center, especially the head and neck team, they're pretty incredible people. All the nurses, the radiation therapists, the technicians, everyone was incredible. So this care right here is second to none.